Aloha from the banana patch in haiku. This is my quick take, building on Lisa's deep take on individual versus community mental health. We're talking about politics and how hard it is to work with folks that are changing every 2 years versus, I guess, the old model where we'd grow up with folks and know them, and so you could work with them in the system, and the political system being your village, not the state or county. So there's so much turnover, and it's so hard to build trust that it's a pretty hard system to work with. Lisa's been looking at W.H.O. and their ridiculous list of citizenship expectations. Ridiculous is not ridiculously awesome, it's just ridiculously ridiculous. They try to measure 5 points of engagement. CDC has the view that mental health is individual. It is based on you. It's your fault if you are mentally unwell. So the question that Lisa has is, who has a community approach to mental health? We're now being asked to imagine the unknown. What if mental health wasn't person-centered? What if perhaps the environment that produces the social economic situation that you are a part of in a location, geospecific, if that is what is contributing to your mental health and the mental health of your neighbor? This is the drawing that Lisa asked me to draw. It's two big hands. It's the CDC. They're pushing people off a cliff. The CDC blames individuals. They're like, "You are responsible for how you feel. This is not social media's problem. This is not the things in your food, the drugs, the anything. This is your problem." So here's the question: how to get the deep take? Because it would take a couple years of research. Do we have time for that? I'm a politician. I don't have time for that. I'm going to make a very quick summary of what I've heard, and I hope that the community takes this on as a question for the community to investigate, because that's how we get things done faster, working together. So here's a couple of questions. What's the history of the individual-based view of mental health? Where is that coming from? And what societies viewed mental health as a community issue? What practices did they use? Who can we look to? Anyone, any sense of other societies that were healthier societies, perhaps because they were more localized and more in community over longer terms of period. I don't know. I'm just questioning, putting out the question. How do we move forward with an environmentally focused approach? This is me doing my best Obama impression. It's my best one. It's the best one I got. We can look at the history in the United States. Think about those movies with crazy people being locked up in institutions and sanatoriums. That's where the model was shaped. The Joker, the Nurse Ratched, those sort of things. One Flew Over the Cuckoo's Nest, those kind of things. In the 80s, thanks to the Wolves of Wall Street, we deinstitutionalized, thank you, Ronald Reagan, which was maybe a boon for the people being abused by the institutions, but also we threw the baby out with the bathwater, potentially, because people need support. They need some sort of structure. So it was an economic decision, not a community-based decision, according to Lisa's read on the history. The history goes back further to the 1930s, 40s, and 50s in America. That's a question mark. What was the history there? I did not do the reading again. I am just the guy posing the question and trying to summarize what I've learned in the last 20 minutes, 30 minutes on this topic of community health versus mental health. I mean, I feel like we're all on this question together. Yeah, since the 1980s till today, our mental health system was captured or has fallen to capitalism, the forces of capitalism, which the war machine, the elements of power, i.e. the media, big pharma, all those things. So there you go. Let's do this. Are we a community, or do we just need to go to our own little? Does this look OCD to you? Am I ADHD, OCD? Am I on the spectrum? What do you think? Do you think I have a mental health awareness issue, or do you think these are good questions that we should be pursuing as a group? Mahalo. Mahalo. Thank you. Thank you, Lisa, for your stimulating mind and conversation. Mahalo.